We all want to live longer and look younger as we age. And what's more important than living longer or having adding more years to your life is adding life to your years, basically. So living, healthier life, being able to do what you like, and maintaining general health and well-being. And we can do that by adopting a healthy lifestyle and mainly focusing on nutrition. And we are about to learn just that from an expert in this field, Dr. Murthy Gokula. And he has been, that has been his passion, and he uses technology and lifestyle medicine to promote healthcare that emphasizes on longevity, vitality, and wellness. So, welcome, Dr. Gokula, to this webinar, and thank you very much for accepting our invite. Dr. Gokula is a board certified physician in family medicine, geriatrics, and lifestyle medicine. He is a clinical associate professor of family medicine in the University of Toledo, Ohio. He's the founder of Global Tele Clinics in India, and he's also the founder of Concierge Connected Care in the USA. And that is a pioneering medical service that delivers personalized, patient-centered healthcare focused on wellness and prevention rather than treating illness. So we are very excited, Dr. Gokula, to hear you tell us more about how we can maintain vitality and how we can age gracefully in our old age. Over to you.
Good morning, everybody. Thank you all for coming on a Saturday morning or Saturday evening there. And I just want to thank Pan and Amrita for reaching out. And we all have our own exciting journeys of trying to manage who we are as a person and how we need to conduct ourselves in both professional and personal life. Like the two wings of a bird, we have a professional career and we have a personal career. And I guess if you can try to make those two wings have a balance and you can fly to your goal, which is good health. I personally, family physician and geriatrics, I've done geriatrics for 20 years. I still continue to do that predominantly, but I was an academic physician and I left the university to start Concierge Connected Care to create a holistic approach to health. And when I learned about lifestyle medicine, that's when everything started unfolding for me. And then I took over a practice that's predominantly anti-aging, which talks about gut health, which talks about toxins and buildup, which talks about hormone replacement therapy, which talks about regenerative medicine, herbal medication. So based on that, I think I got the capsule for health now. And that's why uh, uh, it's like I wanted to kind of make this a lifestyle longevity perspective, this lecture, and I'll also give you my own journey and experience. I hope by the time the learning objectives is to kind of understand the nutrition and what it does for aging and specific nutrients that promote healthy aging and recognize some of the lifestyle factors and understand the challenges and a lifestyle medicine approach. But happy to blend in the anti-aging perspective. So in my mind, if I can address these 8, I call them the steps to, that is what is called in geriatrics now, the modern medicine has created medications and helped them to live longer, but we are not really living a good lifespan. I mean, we're living a lifespan, but not a health span. So there's a difference between lifespan and health span. So most of the geriatric syndromes, we call them, are like frailty, sarcopenia, all these things. But I kind of make geriatrics very funny because I say I create simplicity from complexity to manage multi-morbidity. And my two outcomes in geriatrics are function, quality of life. And when you translate that into trying to do lifestyle and anti-aging medicine, which I call the which I call the 8 pillars or 8 steps. If you can address somebody's inflammation, somebody's insulin resistance, somebody's toxins, hormones, gut health, mitochondrial dysfunction, genetics, and stem cell regeneration, most of it can be really attacked. And in India, in particular, in US, it's 65 years and above, and that's the accepted definition. And if you see that, the age burden is also increasing in India. And non-communicable diseases are really, really high. I did a project with the American Association of Physicians of Indian Origin, and I screened 7,500 people plus in 75 villages across India. And it's amazing to see these people just are off the street, and we screen for 6 non-communicable diseases. The average burden is about 30%. None of these people knew if they had high cholesterol. None of them knew if they had diabetes, chronic kidney disease, high blood pressure, obesity. So I think the changing nutritional patterns across the world and the westernization has created a problem for how the age-old Indian traditions. And I'll be very honest with you, my lifestyle medicine, the first course I went was to a Harvard Medical School 5-day course. And when I was sitting through those 5 days, I was honestly remembering the Patanjali Yoga Sutras, because that's, in my mind, well packaged into what self transformation can happen as an individual, but translate that to health if you can. And that's the journey I'm taking, that we already have that, trying to live that kind of a life and creating that. And Patanjali was a physician too, he was a healer too. So it's very important to understand the roots where we come from. And if we can go back, I think India will do great. And if you see, based on data, proper nutrition can prevent or delay 4 out of 5 leading causes of death in older adults, and frailty is because the physiologic reserve has been decreased. And the point is that the idea of anti-aging is not, and geriatrics now is going towards what is called longevity medicine, wherein we are not worried about the decrease in the physiologic reserve, because that's going to anyway happen. But how do you keep it intact? How do you keep your money with you safe? The physiologic reserve. And that's what longevity medicine is all about. And that's increasing the health span rather than just the lifespan. And if you see the dietary diversity, and it's across very varied, and we really need to identify what's a simple way. And if you look at the data, Mediterranean diet, and if you look at Mediterranean diet, it's mostly plants, fruits, vegetables. And then I have Indians who come to see me. They all have diabetes, and you know that we have the diabetes capital in India. Now, 1 out of every 5 human beings on earth who is diabetic is who is diabetic is Indian. So it's growing because of the lifestyle modifications. And if we can go back to our old Sattvic diet, it's really helpful. If you see what Mediterranean diet has done for people is 25% lower all-cause mortality. And plant-based diet, by all means, have really shown good help for people across the spectrum. And for me, it doesn't matter even if you're 80 years, despite the mitochondrial degeneration, stem cell exhaustion, all this, you really can regenerate all these things. And I'll give you a simple example of meditation. And that's why I take the Patanjali Yoga Sutras, the 8 steps. Meditation is one of that step, dhyana. Dhyana has shown to prolong telomere length, and that's part of longevity. And that creates health span rather than just lifespan. And the important, obviously, people kind of kill the modern world with trying to take protein, and the proteins are only in the animals, and that's the kind of repertoire you hear. But the facts are really different. And you all know, I don't have to preach to the choir here. When you eat meat, what happens is, I predominantly say 3 things happen. One is it gets converted by the gut microbiota into TMAO, heterocyclic amines, and activated glycated end products. AGEs and HCAs cause cancer, and TMAO takes the cholesterol and dumps it in the blood vessel and causes atherosclerosis and heart disease. So now you can imagine that and translate that to India. Everywhere you see biryani points, everywhere you see non-vegetarian stuff, everywhere you see, despite being vegetarian, there's oil, and this is what exactly happens. So it's very important to understand, and all you need protein is 46 grams for women and 56 for male. And you can get that by eating red lentils or dal, 3 cups to 4 cups every day. You know, and obviously, you all know that when you're on plant-based nutrition, you got to take vitamin B12. And if you look at vitamin D, which has about more than 1,000 hormone chemical reactions in the body, very deficient people. So people used to tease me when I was at the university. I used to do this TSH, vitamin D and B12 on everybody. And I was challenged by my fellow, why am I doing that? What's the evidence? So we did a retrospective chart review for all the people admitted for skilled nursing home for rehabilitation, and 98% were B12 and vitamin D deficient. And these were all meat eating people. So just because you eat meat doesn't mean that you get enough B12 as well. But this is one thing, and there is data on the aging process, decreased acid, and B12 absorption. And then the dry mouth, B12 absorption starts in the mouth. And that's the reason you got to chew. And these are all age old techniques that I'm sure your grandparents have told you or your parents have told you. And omega-3 fatty acids, and people produce this salmon you got to eat, but you all know that eating chia seeds, hemp seeds, and walnuts, and doing flax seeds will give you the omega-3 that you need. So, how do you actually complement some of the lifestyle factors, the 6 pillars? I want to kind of make it very simple. If you really want to live long, there is a gentleman called Peter Attia who wrote the book, and still it comes down to, in US, there is all cutting edge technology, cutting edge medications that they use. But who is a longevity expert clearly states that it's lifestyle and exercise. And what exercise in geriatrics will actually, or anybody across the spectrum, if you look at when sarcopenia starts, it's age 30. Really, from then on, every year you lose muscle. So it's important to start resistance training. Aerobics are good, yoga is good, but in India, yoga is there, which kind of pulls in everything. It helps you with balance, it helps you with flexibility, it helps you with toning, it helps you use your own body. So you're really not injuring a lot of. So I have started incorporating yoga for the last 2 years, and every day I get a Zoom class from India. So please start doing some kind of intensity exercise promoted. And then we have the way I do this is we create smart goals, and we call that fit prescription: frequency, intensity, time. And so you can write that down, Google it, you'll get this model, smart goals and fit criteria. So you got to give that prescription for that patient's very specific, and that's when things will happen, because you all know that we all have a consciousness and a subconsciousness, and then when you put it on the paper as a goal that I'm going to do 30 minutes of resistance training XYZ, then that happens. So you should have a journal for your patients, and you create these smart goals, and every day they wake up and write these goals and what they have done. And that's how studies have shown that the engagement will improve. Obviously, if you have technology, there are apps that you can use. Stress management. Meditation reduces inflammatory marks by 15% in older adults. Sleep 7 to 8 hours. You all know that by 10 o'clock, I'm also a victim of this. You got to sleep, because 10 to 2 is when the detox happens in the human body. And sleep is the most underestimated medicine, I call, in this entire human living. If you can sleep 7 to 9 hours, that's the best that you can gift you can give, and the regeneration happens during this time. Obviously, social connections, have increased survival. Now we have a new syndrome called loneliness syndrome in geriatrics, and it's important that we kind of make sure that we don't fall prey to that in India. And I was told by my spiritual guide that in India, when the older adults are moved away from their homes and put in elder homes, that's when the society will degenerate. And I've seen it live here in US, wherein we put people in older homes. We call them nursing homes here, and independent living, assisted living. It's a shame that it's happening in India, but strong relationships are really the key. I gave a talk to a Rotary for a Gen Z, and I really created a pathway of how Gen Zs can actually transform Indian society using technology and keeping older adults home by blending medicine and technology, and call that stay home, and engaging in cognitively stimulating activities has reduced cognitive risk. And I'm sure you can look up this study called US finger study and pointer study, wherein Finland people have actually done a study fixing all the six pillars of lifestyle. They actually reversed the decline of cognition, and now Alzheimer's Association has joined them and doing a huge study. So if you look at malnutrition, it's still very prevalent even in community dwelling older adults, 15 to 30%, and 50% of older adults are in below poverty line. And the good thing about us is we really need to have go back to our traditional fasting practices and kind of get back to our old sattvic diet. And some of the things that can be done is to kind of create community-based nutrition programs, family involvement in nutritional care, and culturally appropriate dietary recommendations. I mean, if you ask a South Indian guy to eat roti every day, he may not. But if you want idli, but then idli can be not white with white rice, but can be with millets, and you can change, add some more vegetables, and be very creative. And some of the way that lifestyle medicine approach is to kind of start small and slow rather than in what I have seen in my practice is rather than saying that I mean I usually have a sheet that I say these are the six things that really cause a lot of inflammation, a lot of insulin resistance and toxin buildup, and my eight things that I say that they influence the genetics. One is the processed food, and I think that's the curse for Indian world wherein everything is getting processed now. Sugars, animal products, dairy. In US, all the farming for dairy is they're loaded with hormones and antibiotics. Uh, Dairy, gut, gluten, and refined flours. So, and then I kind of asked them to, I then slowly introduced them to plant based, whole food, whole grain nutrition, then slowly introduced to exercise. And then obviously, you all know what alcohol and drugs do. They're significant inflammation, uh, apart from other things. I try to give one reason why I'm saying what I'm saying, and then sleep. Sleep by 10 o'clock, wake up by 6 o'clock, and then meditate every day. And people normally say, we don't have time for that. And I say, at the end of the day, before you go to bed, you can do any breathing meditation. And India has given yoga, pranayama is the best. And you kind of have to do it very personalized. And for me, the way I do it is very preventive. I say that if you do all these things now, at the end of the day, your independence will be there. And I kind of say that the interventions as a geriatric specialist that I do is not to prolong your life, but to stay young and die young. And you can continuously monitor every 3 months and education and empowerment for older adults. But I know habits die hard, and you all know that the simple solution is lifestyle, and it's important that we embrace. And it's important that when you put it in practice, you create those smart goals. I actually created a diary with smart goals and fit prescription every day, and people write what they have done if they have conquered their goals. I think there is a difference between an app and something writing that I've seen that most of the older adults, about it's a 50-50. They love technology and they embrace technology. Some of them will have flip phones even in America now. And so I just wanted to kind of bring you all up to speed. What's aging? You see that there is cellular damage, the epigenetics, and lifestyle can reverse 80% of these problems. Inflammation in the body, adaptation to stress, proteostasis, stem cells and regeneration, the metabolic problems. And now we have tests to do all these things, and you can really address most of these. And as I've said, if you look at what's the pathophysiology of aging, and you can see that nutrition and physical activity kind of create a lot of influence on how you can actually evolve and improve and survive and create body homeostasis despite all the oxidative stress, the radiation, the UV light, chemicals, pathogens, psychosocial stress, high fat diet. What I have seen in my practice is despite being perfect in all the pillars, and if stress is not fixed, it trumps the other pillars. My numbers are not high, but my observation as a clinician and doing labs, stress is really, really important. And one of the reasons why we have a great system in India is we used to have a joint family and people used to be under one roof. It's all disappearing. And I think that really leads to social isolation and kind of sense of revamping, the purpose and human existence, And in US, they actually did a study. One of the guy, um, uh, he went to Harvard for medical school. He was from Italy, and they ate all the American bad food, but that little village, the Italian migrants had less heart attacks. So the reason was because two, three generation continued to live together despite uh, moving into American diet. So, if you look at healthy aging, it's all about tissue homeostasis and then recovering the function. And you can literally reverse a lot of these things by addressing the eight things that I've told you guys and readjust and repair. And when you're frail, the reason is because of all these pathophysiological mechanisms, there is uh, uh, there is no metabolic flexibility and plasticity and a lot of inflammation and that causes, and we have a whole lecture, actually a conference done in anti-aging medicine called inflammaging. So it's very important to understand that aging itself, if you look at the longevity perspective, is a disease. If you look at it as a disease-centered view, and there is a decline, we call that the physiologic aging of organs. For example, one third of nephrons are gone by the time you hit 65. There is decreased functional residual volume in lungs. There is muscle loss from 30. If you see, there is decreased migrating motor complexes in the gut, and you see that the detox pathways are degenerated. I mean, these are all physiologic mechanisms, but how can you keep that agile is trying to address by trying to create more emphasis on the nutrition, all the six pillars, and then addressing some of the things. Because I found that new lifestyle medicine predominantly fixes inflammation and insulin resistance. But when you go into anti-aging medicine, you kind of start replacing the hormones, start replacing the gut health, start replacing their toxins, some of the toxin buildup. There is a way that you can do with natural diet. There is a way that you can do like simple sauna. There is a way that you do with exercise. And if you kind of address like mitochondrial dysfunction, you can regenerate the ATP by providing the body with the right kind of foods. And then there are supplements as well. So that the whole point is to impress upon the patients to have a good lifespan or create health span. So if you see the aging, it's a burden. Even based on 2011, 60 plus 104, and there's a increased projection, and people are living up to 90, but it's all non-communicable diseases. And if you have heard of this, great. If you have not heard of this, please buy this book, How Not to Age. This is the most comprehensive evidence-based review that you can get about in a very scientific way and in a very natural way. Dr. Greger has been a pioneer, and he has a free app called Daily Dozen. Please download it, and you can get a lot of information that's all free. I'm his fan. I had the good fortune of getting a book signed by him, and that's my Bible for anti-aging. And his Gregor's, I just summed it up for you guys. What are the things that you need to do for a healthy aging? So, nuts, greens, berries, trying to kind of maintain away from plastics. And here I am drinking in copper, or our age old matki, pre and post biotics, calorie restriction, protein restriction, and NAD. And if you see the kind of diet, it's plant based, and the beverages is mostly water. And the centenarian diets, I don't know if you heard of Blue Zones. It's a good thing to watch on Netflix. And they kind of talk about the thing, plant based eating, lifestyle, exercise, weight control, because this is insulin resistant, sleep, so underestimated, stress management, and social ties. So you have the answers here. Now, how do you translate that into into your practice is you kind of have to kind of address all this step by step, and then and I kind of have a little one-page summary that I give to people. And as I said, that if you address these eight pillars or eight, and then I'm actually integrating um, the eight habits to kind of start doing self-evolution. I'm going to make it funny here. I want to make America healthy again, or keep America healthy always. You know, so if you look at that acronym, it's KAHA, 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 Keep America Healthy Always, which is the voice. I just really want to spend the rest of my life, 10 years, preaching about this. I'm about healthcare, not just sick care. And if you look at the WHO definition, it's about physical, mental, social well-being, addressing the body, mind, spirit. And that's the whole thing. And Indians have conquered this. It's just unfortunate that we've moved away from that and coming back uh, to the roots of our culture, roots of our habits. I think will transform health for yourself and health for your patients. And if you see, I don't have to preach that there is a lot of chronic diseases in Indian geriatric population, and the traditional Indian diet, like high in fiber, antioxidant, plant-based proteins. And if you look at it, we actually have a better approach because we never used a lot of oil to begin with. It came along the way, and but nobody really took our diets. They looked at Mediterranean diet, and but if you look at the older Indians, when you had this ashrams, when people were going there, they had a schedule that they practice the eight steps. If you look at the Patanjali Yoga Sutras, the eight steps, and if you can bring that into modern medicine, I think we'll do a huge service to our country and to the world even. And I'm glad that yoga is now recognized all over, but it's not what really was originated. If you look at what my teacher is now teaching me, it's like amazing how much there is the depth. Uh, the mudras, the pranayama, and then the asanas. If you put all that together, and now there is data now when you do breathing exercises, your stress changes. When pranayama, you can do those simple without any cost at home, and this is like the classic definition of American College of Lifestyle Medicine that says that if you do increase nutrient dense, antioxidant rich foods, decrease or eliminate exposure to dietary toxins such as oxysterols and cholesterol oxidation products called CHOPS, which I gave you some of the heterocyclic amines and the activated glycated end products. And uh, then why you may question, why is India, despite being predominantly vegetarian, why are we suffering? Is because I think we moved away to a lot of processed foods, a lot of refined flours, a lot of oils, oil-based diet. I had a Jain who was a vegetarian. He's 83. His A1C was 13.2. I gave a lecture at the temple. He followed me to my practice. 1 year, in 6 months, I got it down to 6.2 by just eliminating oil and reducing the amount of salt. I mean, his hypertension got better. People think salt is just okay, but there's a lot of data on the amount of salt. And but Indians, if you look at their dietary patterns, we have a lot of things that can be used instead of salt to make even better with spices and everything. So this is what America eats, and I'm sorry to say this is what's happening even in India now. When I come there for a visit and I stop by, it's predominantly a lot of oil. Despite being a dosa, it's still a lot of oil, and that's where calories come from, as you all know. And move it. I just say, 25% rule, fruits, 25% vegetables, 25%. We have the advantage of grains with millets uh, and brown rice, and then you go for lentils, and we have the lentils that nobody can even talk about, in rest of the cultures. Plant-based diets reduce heart disease by 40%, cerebrovascular disease by 29%, metabolic syndrome by 50%. Now you know uh, why we have had explosion of diabetes. So see, I actually told you about eggs. People may debate and a lot, but there is always lobbying from the industry. But eggs, simply it's phosphatidylcholine, and the gut microbiota changes into TMAO, trimethylamine oxide, dumps cholesterol. people, I just want you to understand that body doesn't need cholesterol at all. It manufactures 1 milligram by itself by the food we eat and creates all the hormones that it needs. But we dump a lot of fat into the body, and body doesn't know what it, and that's the problem for us. And it doesn't matter, even plant-based diet, if you grill a lot, it creates activated glycogen products. So that's why if you see the grilling cultures have a lot of stomach cancers, like Japan, is because of activated glycogen products, which creates free radicals and then cancer. So I really kind of have created this, you just try this for yourself. Processed food, take it away. Sugars, dairy, refined flours. I mean, look at maida that's been exploded in Indian culture now, and that's a disaster. And gluten, because it's genetically modified, has created a lot of celiac disease. And you try this for yourself, and you'll be amazed to see how much difference it makes into your own health. Corn also, and soy, they're genetically modified. And I said, smart goals is way to go. Specific, measurable, achievable, reliable, and timely. Because if you don't create these goals, nobody is going to change the way they're going to uh, modify their diet. When you're doing plant-based diet, obviously always make sure that you tell them to take vitamin B12 supplement. And vegans in the past, when they ate yogurt, and now you can do plant-based yogurts too at home by yourself. So I just thought, if you people have heard or not, there is what is called longevity diet, and it was published in 2022. Moderate protein intake, complex carbohydrates, healthy fats, and if I have to do it in Indian context, plant-based proteins, lentils, whole grains, brown rice, millets, and traditional spices reduces inflammation, improves metabolic health, and extends lifespan. And this is data driven. And I just wanted to kind of give you guys, what happens in if you have to look at diet, the genetics, the size, the age, sex, health status. You got to optimize this. If you look at it, it's mostly non-refined carbohydrates, 45 to 60%, and fats that are mostly plant-based, 25 to 35%, and protein that's 10 to 15%. And you can see what it does. The red causes the increased animal fat, sugar, animal protein, causes increased methionine and increased insulin growth factor. IGF you can measure, and that's a marker for actually insulin resistance, and then further problems, with increased insulin resistance, increased and oxidative damage, inflammation, and then causes problems with diabetes, cardiovascular, cancer, neurodegeneration. So if you downregulate all these things by following a simple diet to start with, you can really affect all these mechanisms within a human body. And that's the reason I kind of said, and now in Dr. Greger, he actually gives you some vegetables that influence all of these factors. And he's a strong proponent of nutrition medicine. So if you look at you need 1 to 1.2 grams, and it's very easy. A cup of dal gives you 15. You eat 4 cups, you get your protein for the day. And vitamin D deficiency is huge. B12 deficiency is huge. Very important. You'll be amazed to see. I just had an Indian CEO here, very successful. He has about 2,000 employees. This guy is a CEO, successful. His PCP did not order B12 vitamin D. He's middle-aged, 40 plus. His vitamin D was like 12 and B12 was 140. And he's questioning me why his doctor didn't order that test. I'm just telling you that it's commonly missed. And I'm glad in India I see this ordering a lot. And because I get all these free consults in WhatsApp, and I see a lot of people are getting these tests done. But it's important that you add this, and thyroid too. But once a year is enough. And the reason dehydration is important, I emphasize this a lot, is your body weight divided by 2 is the amount of water that you should be drinking per day. Because as you age, there is increased visceral fat in the human body and decreased total body water. And as you all know, the body is predominantly water. If you don't give water to the body, then you run risk of trouble with metabolic reactions. So high dietary diversity, the rainbow colors, rainbow foods is very important. And then, we have the luxury of getting all kinds of vegetables in India, and it's important that we go back to our roots. As I said, that there is what is called Mind Diet that has been published that reduces 53%. I mean, there is a program called Neuron Program. If there is a book that you love to read about dementia, it's called The Alzheimer's Solutions by Dr. Dean Sherzai. And it's very important because he created that neuron program in the community adults. And I spoke with him, and he says that literally, Murthy, in my clinic, I can't claim big, but I've reversed mild cognitive impairment, reversed mild dementia by just this neuron program. And it's again goes back to lifestyle. Um, it's very important that the resistance training with adequate protein, it's important to kind of change the muscle health, prevent sarcopenia. This is the data. And 25 to 30, which is, as I said, 2 cups of dal, which we do every time. And the important is when you eat protein intake within 2 hours post exercise, increase muscle protein synthesis by 33%. So it's very important when you actually ingest and how you do. And also, post meal exercise, whether it's walking 15 minutes to 30 minutes, has changed the insulin resistance. You know, calorie restriction, in India, people have put all these vrats and the fasting, and that has shown to improve memory in older adults. Time restricting eating has also helped. But one thing I would caution is that you have to personalize the intermittent fasting for patients, because in the perimenopausal and menopausal, because of the hormonal changes, some of these fastings create a high cortisol, and then that kind of makes it difficult for those patients and they give up. So just a piece of a little caution with perimenopausal, menopausal. It's important that you always measure the cortisol, and AM cortisol is one of the ways that we do here, and we have saliva testing. But just remember that calorie restriction in perimenopausal, menopausal. Gut microbiota. This is the key. There are microbiome labs all over US that are funded. 80% of problems happen with gut. And in India, when we were kids, we used to play in the soil, we used to do all those things. Now everything has changed. We are getting this high-rise buildings everywhere and concrete jungles. So it's important that we go back to kind of how diverse the gut microbiota. The hunter-gatherers microbiota, or the people who live in tribal areas, they don't have all these problems of the modern world. And it's because they they have changes that they have seen very clearly, that it's important that you pay attention to this microbiota and what it does to aging and cognitive function. It's called the leaky gut. And I wanted to bring up that 10% of human, how your body microbes hold the key to health and happiness. It's a great book. We host up to 100 trillion organisms, make up to 2.2 pounds of body weight, and microbes are really important. And there's gut-brain axis. If you look at what it does to weight gain, bowel movements, nutrient delivery, microbial balance, I make a joke that if you can have an older adult have bowel movement every day, life is all good. If they urinate every day, that's all good. If they eat every day, it's very good. These are simple things. It's like little pediatric patient. If they smile, you know that they're really doing well. And because it has an influence on neurotransmitters, stress, anxiety, mood, behavior, and you get microbiota changes every second based on your lifestyle. So that's why I think we should really focus on health and happiness medicine rather than just doing one thing. This is the data very clearly published, what it does to the gut leakage. If you have a Mediterranean diet or a vegetarian diet, there is increased short chain fatty acids, and then no translocation, decreased anti-inflammation. And these are the microbiota. These are like solid data is there behind. And then when you have the Western, the ketogenic diet, and the choline, carnitine, with all these things, as I told you, the TMAO, what it does to the fibrosis remodeling, reverse cholesterol transport, platelet aggregation, endothelial inflammation, insulin resistance, lipopolysaccharides, and then you have this gut leakage that creates the change in their gut microbiota and causes the problems. I mean, in critical care, they've done studies taking their gut microbiome. It's a huge gut leak syndrome, And I just want uh, people to understand and pay attention. And for me, I like to live very inexpensive, order less tests. The best way is 80% of people get better once they move to plant-based, whole food, whole grain nutrition and implement all this. But I've found that you also have to have them to exercise and then detox by sauna is the best way. Or if they can, but if they can't, then probably, a lot of sweating really changes the dynamics. A detox diet has helped people, and eating cabbage, I mean, there are three phases of detox. I don't want to digress, but you can literally address by diet all these pathways in the human body. So you see, some of the problems is we have malnutrition, the poverty, and then, but I just want to kind of see what chronic disease is all about. Unhealthy diet, sedentary lifestyle, very common now, high stress, medications, poor sleep, addictions. They change your gut microbiome, they change the epigenetic cellular stress and creates inflammation and all this obesity, type 2, cardiovascular disease, cancer, depression, other diseases, And And it's very important that you address all the six pillars. And mini nutritional assessment is a best way to do the nutritional assessment in geriatric clinics. And there's food questionnaires that you can use. And personalized nutrition is very helpful. Family involvement, community health. This is the published data that has shown that these really work in dietary counseling. And the way the future is going is nutrigenomics, metabolomics, and gut microbiome research. In my clinic, I actually have a DNA test that gives me all the. It's just a swab that I do, and it gives me a path as to how their nutrients are being assembled, how their hormones, how they're detoxing, and what I can do. Uh, but if you don't have those tests in India, but strictly moving them to a whole food, plant-based, whole grain nutrition, and moving them from the six things that I've kind of identified, predominantly, and create a personalized nutrition approach. Rather than avoidance, we should say that we are adding new things and we're not taking away everything, because people tend to have some kind of attachment to food. But there is clear data that they have done MRIs of the taste buds. You can literally 21 days, the whole uh, taste buds change. And I've had patients who are completely meat based people that they have been forced to change because of their health crises. And they say that actually there is a joy in eating different varieties of plant based options, and it's important we do that. Community kitchen gardens have really improved dietary diversity, even in rural elderly. This was published in Indian Journal of Community Medicine. And lessons learned, culturally appropriate interventions, 40%. You can't ask Indians to eat quinoa, or, I mean, we have millets, so let's work with millets. I have a lady who helps me with cooking from Atlanta. She's an Indian, Shobha, and she does cooking sessions. She made ragi roti and other rotis, and then you can eat that. And I kind of created my diet song. I wake up sad. By midday, I'm mad. By evening, I'm crap. What that means is the standard American diet, full of processed food, meat based, By midday, I'm kind of mad. So I go for the modern American diet. By evening, I go for crap, which is calorie rich and processed foods. I think this analogy is pretty much happening in India, and it's important to change and create smart goals that are specific, measurable, action oriented, realistic, and time sensitive. This is how you implement all these. So it's just as simple here, like increase dietary diversity score by incorporating five different food groups, and different colors and measurable. And then you can see what they're doing every day and how they're progressing in 3 months. Reduce processed food by 50% over next 6 weeks. Increase protein intake, have they added dals and lentils, time bound, with a uh, have them time restricted eating. So this is how you create smart goals and give them in writing. And uh, and the fit prescription, as I was talking to you about, change from sugar-laden desserts to fruit 5 days a week, one serving a day, dessert, fruit. Consume more veggies every day, two servings during meals. So, like other doctors give prescriptions, we give this prescription for each of the pillars. And this is how you, for nutrition, you can say eat three balanced meals, include 2 to 3 healthy snacks. And studies have shown that if you have more of what you can show people, that's what people eat. If there are a lot of vegetables and fruits lying around with some hummus or some, chutney that we can make, that helps. Practice time restricted eating 5 to 7 days, intensity, nutrient dense, aim for high diversity, and vegetables, whole grains. This is how you can literally create a fit prescription. And if you can see, as I said, our goal is not to create people, everybody, but the modern medicine has really gone into a sick care model. We are creating sick care specialists. But what we have to do is to bring back homeostasis and this is published what you can do. Simple grip strength in the clinic gives you a lot of information by VO2 max. If you make them just walk fast and you can see what they're doing and improve their vitality, I call them. And by addressing their sensory, locomotion, psychosocial, you can literally change a lot of things. As I said, I call them the 5 pillars. Now I have added 3 more based on what I've been seeing. Is you can literally prevent and disease reversal with lifestyle and anti-aging by addressing the inflammation, insulin resistance, toxins, hormones, gut health, addressing their mitochondrial health by regeneration and stem cell regeneration, and addressing their genetics. So the key takeaways are dietary diversity crucial for healthy aging, proper nutrition, physical activity, and social engagement. Very important, very effective. People underestimate what it does to people, and culturally appropriate interventions. So I'll stop here, and I want to take questions and I see a lot of comments, but I'd be open to questions. I hope it was timely.
Yes, thank you very much. That was a very informative presentation. And thank you for sharing your knowledge and expertise with us. There are a few questions. As a community physician, I cannot advise chia seeds to a 70-year-old farmer by occupation who earns 10,000 per month. What are some cheaper alternatives, cost-effective alternatives?
Oh, it's interesting that we kind of want to do all this gizmo stuff. Millets by itself have actually had significant, and they grow that in rural areas. They're cheap. Do that. Plants. If your chia seeds are not the omega-3 fatty acids, we talk about all that, but they have peanuts there, right? In India. Eat those. What is locally available? So, and seasonal. Studies have shown, and Ayurveda was designed predominantly around the seasons. So the Vata, Pitta, Kapha and all that was predominantly designed about, okay, so you go back to your roots of trying to eat based on your seasons, based on locally available. You don't have to push chia seeds on a rural person that's for me is nonsense. Tulsi seeds, which we have abundant there, do the same job. They have, I'm missing out on that. In Faluda, they put that. They're all available in India. You don't need chia seeds for that.
Which edible oil is good for daily use?
Oils, it's a whole different talk. There is what is called boiling point for the oil. You have to have a high boiling point for the oil. And for me, if I have to say that sesame oils are really helpful. So sesame oil has a high boiling point. It's good. Uh, Here they talk about oil and avocado oil, but the point is it cold pressed or is it refined? So in blue zones, when people were eating meat, drinking alcohol, they were not really getting processed alcohol, processed food, meats. They were actually growing everything they knew, but they ate little. They actually brewed their own alcohol. For generations they did that. The point is, I always say the bread is not bad. What it made of is bad. Nowadays you get white bread. Same way, oil, if I have to say, stick to the age old, wherein you had, I think now in urban India, it's coming back that it's called cold pressed oil. Yeah. So anything, but I think peanut, but again, oil is calorie dense. Fat has 9 kilocalories. Carbohydrates, protein have 4 kilocalories. So that's the reason in the longevity diet, you see there is a lot of complex carbs, I call them whole carbs. So less oil. Oil was not there in Indian cooking. It came along the way when people have kind of figured it out. But as much as possible, like a spoon of oil has 145 kilocalories, and then you have to run a mile, that's 1.5 kilometers, to burn 100 calories. Are you really doing that every day? In So this is how you have to think.
Uh, Kindly repeat the formula for the amount of water for daily intake. I think
I
because we
mean,
focus on kilograms here, I think that's what is confusing. Mm.
yeah, I mean, I'm not good at conversions, but it's very simple. 70 kilos by 2, 35 kilos. If you turn that to ounces,
Yeah.
that's the amount of water. For me, I normally say 3 to 4 liters of water. Obviously, you'll have patients with renal failure. I'll just cut them into half. And you'll be amazed, even renal failure patients. But it is a law. This is a physiologic process that happens in elderly. Your total body water reduces and your total visceral fat increases. I don't have to prove this again. What does COVID like? Visceral fat. Why did elderly get hit? Because COVID hit visceral fat. Okay, so increasing water, that's very, very critical. And then there is data on alkaline water, and this is what creates alkaline water. We did this in the past in India. Okay, and then we had matki water, which was more minerals and everything there. Now you have all this fancy reverse osmosis, this nonsense, that. I think the modernization has killed a lot of humans, um, caused a lot of chronic problems in my mind. Okay, because I don't know, I'm being very honest. When I was at Harvard listening to those people, Indians have done this 5,000 years ago with Patanjali Yoga Sutras. And why are we again? We don't know how to package it and sell it. Americans know how to package it and sell it.
Yes. I think for Indians, if you think in kilogram per kg body weight, about 35 ml per kg body weight is what roughly we should be consuming water. And because we don't use pounds and ounces, I think that formula will be a bit difficult to follow.
This
Um,
is this is just an average. I'm not saying
yes, yes.
this is just. I
No,
mean, if you start coaching them, you'll be amazed. I'll be very honest. I have cured so many problems just by hydration in elderly patients. I'm not kidding with you. So this is simple. But in elderly patients, everything that you do, is it improving their function? You know, just you don't have to do fancy. You can do like for quadriceps strengthening, you do this utak baitak. We call that in India, that's holding something. Quadriceps strength has reduced falls, you know, increased their grip strength, has changed the outputs with their health, heart failure, and everything. So the point is simple things, keep it simple and doable. you
I
know
think following the age-old practices, diet, same food, exercise, yoga, all of that, I think really helps.
yeah, I mean, if you look at the Ashtanga yoga, yama niyama, that's like universal. Be simple, be honest. That creates happiness, right?
Yes.
Not complicating your life. Don't hate somebody else. Anger and anxiety creates neurotransmitter changes, creates gut changes, creates. There is a gut brain axis. That's why I wanted to put that. The vagus nerve is called the super highway. So people underestimate, and that's the reason resorted to meditation in the past. People resorted to having their daytime, me time. Self care. That's why I love lifestyle. I didn't know that self care was important even for me, which I was burning candle from all sides. Even I do now, but the point I'm trying to make is I'm more aware of it. Lifestyle medicine is all about becoming aware. It's not about completely abandoning everything. And once I'm aware, then I make better choices. I honestly did not know all this information until I finished. Once I went to that, and I'm a I mean, geriatric program director at that point in time, teaching medical students, residents, and fellows. So we don't have the knowledge, but I've seen that going back to simple thing will help.
Yeah. What what would be the best way to detoxify a body?
Yeah, as I said, sweating will help. And I mean, the cruciferous vegetables, they have a way of detoxing. Cruciferous vegetables are like cabbage, cauliflower, you know. I mean, in America we have kale, arugula, and all those things, you know. But for us over there, I think mustard, all these things, you know, the cruciferous families have a lot of detox. Uh, but there is a medication called milk thistle we give for detox also for the liver. And then sweating, anything that sweats, you detox a lot of stuff. So in US, you sit in sauna, but in India, I think you have a natural sauna with sunshine. And it's
Absolutely.
amazing. It doesn't matter, you know, the vitamin D that makes it happen is usually there is a time frame. I don't recollect the exact times, but it's like 10 to 2 or in the morning or
There
around
was,
that time.
yeah, there was a study which showed in Tirupati, 11 o'clock, if you get sunlight, that's the best, that's the optimum time. There was an Indian study done.
Yeah, yeah. So usually around the world it's 10 to 2, I call that. You know, I just like to keep simple. Sleep by 10 o'clock because that's when the detox happens. That is, oh yeah, what's the natural way? Please sleep by there is so much data that if you don't sleep, there is a lot of inflammation that happens. And it's simple logic, you know. I used to eat at 12 o'clock in the midnight because I used to write papers, publish, and 3 o'clock I used to sleep. Well, I never gave my body detox. 10 to 2 is when it detoxes. And I eat in the night. Digestion is a sympathetic process. Your body, based on diurnal rhythm, is going into parasympathetic process. Sleep is parasympathetic process. I mean, I'm just oversimplifying this. When you eat after 7 o'clock, we didn't uh, we didn't have we didn't eat after 7 o'clock after that, you know, and then we ate the next day. So you got intermittent fasting 12 hours already, and then we incorporated all these things. So yeah,
Following the
detox. These are the
circadian
three
rhythm.
things.
Yeah.
Yeah.
Uh, can you please explain how gut microbiome diversity achieved in a normal middle class diet? Any comment on plant points?
Absolutely. Increase the diversity, the colorful nature of the plant, and look at what the nutrient density is, and that changes the gut microbiome. The one thing that changes gut microbiome significantly and increase short chain fatty acids, because that's the key. And then butyrate happens, and butyrate is what, and here they throw pills, which is stupid, you know, in my mind. It doesn't matter. Don't supplement anything. Please go back to fiber. Uh, and again, fiber, again, there is a discussion about soluble fiber, insoluble fiber. Then lentils, some people get gas and all that stuff. But the way you do it is, that is again, because we eat the same thing over and over and over and over. So we need to change. So you got to change what you eat every day. That's how diversity happens. Then fiber again makes the gut microbiome healthier. And so, I mean, this was a study really done, you know, between pets. You know, Indians used to have a lot of pets around and animals around when they were like, and dogs, when people have dogs, your gut microbiome is better when compared to cats. Okay. I don't know what dog does outside, but cats are not really helpful for you. But dogs, diversity for gut. But to keep it simple, plant-based whole food, different varieties of vegetables, different varieties of pulses, which is lentils, different types of grains change the game for us. And millets have shown so much improvement in gut microbiome and fiber too. You know, anywhere there is fiber.
Yes. Eat
And
the
I just wanted to throw this: when you have lentil issues, take away the skin, soak them overnight. Next day, boil them on an open thing, because now we have gone into this pressure cooker stuff that causes more gas and then we have to take away the top layer when you cook and wash it off, you know. So soaking, open cooking, skinless, these are all the better ways to reduce gas.
um I think there is this myth in the rural area that eating chia seeds every day can lead to kidney damage.
I mean, first of all, why do I push chia seeds for this old in rural areas? It's, I think in my mind it's wrong. Go back to your simple diet. That's why I made that. I just didn't elaborate on it because culturally specific diets are the way to go. I'm not sure about the renal damage. I actually did a study. I mean, you may be thinking I'm nuts, but I really dreamt that I wanted to create a water pill, and I thought chia seeds. So I literally grinded the chia seeds into different particle size, and then I actually gave it to medical students, and based on the particle size, because chia holds about 5 to 7 times of water, and chia is high in fiber, high in antioxidants, and there is an African subset that even killed Olympic people because they ate chia seeds all day. So but the point I'm trying to make is it helps in hydration, it helps in fiber, it helps in, but I'm not so sure how that has a role to cause kidney damage. I'm not so sure. A
Kidney
myth.
stone, yeah. Kidney stone and acidity are major problems due to change in water quality. Any remedies that can be done with water to mitigate the issue?
I mean, it depends on the kind of stone, right? I mean, kidney stones definitely have been reduced significantly with plant-based whole food diet. Saturated fat. So, coconut is a good saturated fat, right? But it's a saturated fat, so it's a disaster. It doesn't matter what it is, even if it is plant-based, if it's saturated fat, causes problems. So, uh, eating polyunsaturated fats, eating a lot of plant-based whole food, eating nuts, and uh, alkaline water, copper-filled vessels have shown to be helpful with moving the water into alkaline. And uh, if I have to uh, kind of, there are some herbs that can be used to help prevent kidney stones, but hydration is the key. And if it is, like, as you all know, struvite stones are based on infection, and oxalate stones, then you have to figure out whether they're overproducing or under excreting, and based on that, uh, and then potassium citrate is an awesome thing that you can alkalize the urine and then get oxalate stones out.
Yeah, are there any other ways to make water alkaline other than
I
copper?
mean, I don't. I mean, I've started using after I read about the importance of to copper vessels. I got them from India. I think that's the easiest way that I have found, to be helpful. Or matki water. Go back to your matki water. I'm not saying matki water is alkaline, okay? But they have actually said that the minerals, the water and the minerals and all is different because it's just different when compared to the uh, and then all this people start thinking in India also it's a fashion to drink water in plastic bottles. Moving away from plastic bottles is the key for everything because microplastics. JAMA just published a paper with carotid artery dissection that there have been microplastics in the plaque, and even in coronary arteries there is microplastics because of using so much plastics, and all the women like makeup, and there is so much of plastic derivatives in all those things. So I mean, what Indians used to do, I still remember my mom used to kill me with that shampoo. I don't know what that shikai
Right.
that that
Right.
with that I used to hate head baths because of that, because they all used to go into the, but that's much better than your advanced modern stuff because they are all chemicals and you're absorbing. And I see those chemicals because I check them. We have a thing called Nutrival, and it gives you all those petrol derivatives, and they're all high in people. And if you see them, they're just normal people. But the modernization, and I still remember that moong dal paste my mom used to rub on my skin and then take a. I mean, the point is, keep it simple, go back to age old traditional Indian practices, sattvic diet, and people say that it's difficult. It's not difficult. It's just going one step at a time, trying to implement it.
I think using processed food and all the chemicals that we use in
Yeah,
shampoos and soaps and powders and perfumes and all of that is increasing the rate of cancer and all of the other things.
absolutely. And in India, you don't even have a regulation. At least
Absolutely.
America, there's regulations, but still, they're lobbyists. So there are a lot of things that they don't have to declare. and subtly they're there. So I just came up because I've seen this over and over that when I stop the processed foods, people in the autism spectrum also they reversed. So
Yes.
somewhere some chemicals are messing their gut health, and gut health has strong connection with ADHD, autism spectrum disorders, all
Yes.
those things.
Sugar is bad for, I mean,
Sugar
sugar.
is very, very inflammatory. Very
If you're
inflammatory.
on ADHD, if you stop sugar, they get much better. Much
Absolutely.
like
Inflammation, gut leakage. And I actually, I don't know if the audience will be interested in this, but because I took over a practice, I do regenerative medicine called platelet-rich plasma. We do what is called prolotherapy. It's nothing but 50% dextrose. I mix it with lidocaine and I create a solution of 17%. If you have a tennis elbow, I inject into the tennis elbow. That actually starts the inflammation process. Sugar is so inflammatory. If there is one thing that is got the, and look at what Indians do. Everything's mitha khana hai, mitha khana hai. You know, every festival we have, and that's the problem for us.
Yeah.
In the past, mitha was all about natural way of making it sweet. But when sugar came in, it's a disaster.
We'll just take one last question. Suggest innovative ways to incorporate strength training in the elderly as it helps in sarcopenia.
I mean,
Strength.
as I said, addressing the quadriceps muscle, addressing that exercise, that focused exercises to build the thigh muscles. Because what happens in aging is when you're young, you use the thigh muscles to get up. When you get old, it's just the way it works because these people are sitting more and more as you age. The calf muscles and that group of muscles are being used by elderly. That's why you see these people wobbling when they're getting up from the chair. So going back to improving the quadriceps and the thigh muscles, that will change the game. And I'll just say, hold on to the kitchen table and do this 10 times. And you have it. And then again, balance. Chair yoga can be a good way to start with frail individuals. And then slowly, once they move, then you start improving into actual yoga, because if they have to go to gym they won't do it. But again, sitting down and getting some weights, they don't have to go fancy. Get some cans and tie it around with a cloth, and you can, a kilo can and then put it around your ankle, tie it and lift it, keep lifting your leg, by sitting down. That will change the quadricep strength. I mean, um, and then plant-based whole food whole grain. I mean, recently I did I mean, it's my dad's friend, and they called me. I mean, mismanaged Parkinson's disease, but it's frailty. And all I did was to change medications, put the Cinemet every 4 hours, and then addressed her mental health, which is very not addressed at all in India. So sometimes people are depressed and they don't exercise. So you need to understand their psychosocial medicine. I created a little funny way. I like to make it simple. My MP4 model, you know. Uh, so my song, my MP4, my jukebox. So, you have patient values, patient preferences. You have the acute situation, the chronic situation in a geriatric patients. I dump it. I look at the microbiology, the pharmacology, the physiology, the pathology, and then psychosocial. And the song that comes out is function, quality of life. So anything that improves function, quality of life, I will fight for it and do it. So this question is great. To sarcopenia, as I said, it doesn't start at 60, it starts at 30. So you got to, and then if an older adult sleeps in bed, does nothing for 24 hours, his function declines by 3 days. It's just an average. So you got to educate these people. If you don't use it, you lose it, and start making them individualized programs. I'm 56. I don't think I'll be frail. I'll never be. I mean, I have a test. I'm taking my anti-aging boards on 14th. After that, I'm going to start lifting. I mean, you got to kind of start doing these things for yourself, and you got to look good first before you tell your patients. So I took entire year changing my lifestyle because I ate meat every day from childhood from India in India, 3 times a day, because I grew up in a British kind of boarding school in Hyderabad, wherein we had meat every day. Started with egg, bread, butter, jam, and then this was in 68, 76. But the point I'm trying to make is it starts with you. When you change, and people now ask me, there's a little glow in your face. It's because of plant-based nutrition. I'm not 100%, but you actually have to be the epitome before you advise somebody else.
Absolutely. Thank you very much, Dr. Gokula, for a very, very informative talk and engaging so enthusiastically with all our audience and answering all our questions. And we hope to connect with you again and have you over for our discussion forums and webinar again in the future. Thank you
Oh,
very much.
thank you, Amrita, for having me here. I hope it was helpful, and
Thank
uh, and uh, happy to kind of share my knowledge, and I'm so excited that I was able to do this. Thanks for coming on a Saturday evening and patiently listening. Thank you.
thank you very much. Thank you.
Good
Have a
night, everybody.
good night. Bye.